Hello, welcome back to Life Reconsidered with your girl, Dr. T. I want to say a very big thank you to everyone who has subscribed to my YouTube channel, particularly to those who have subscribed recently. I really appreciate all of you. Thank you, thank you, thank you, and welcome to the family. Today, we want to look at triggers or mental health triggers. We want to look at why we get triggered and some types of triggers. In a couple of weeks, we will be looking at some symptoms we experience when we get triggered and how to manage triggers and our emotional responses. So let's dig right in. When we say a trigger is anything that brings on or elicits a strong negative emotional reaction. A trigger can be a person, a place, a thing, a smell, odor, a specific date, or a situation. And when we talk about triggers, trigger can also, come from so many different places. One place that trigger can come from is when we feel that somebody is taking advantage of us, when we feel that somebody is looking down on us or demeaning us in a way, when you feel that you are in a place of danger, you can be triggered. Or when you feel like your boundary has been crossed in the context of dealing with friends and families. Or when you feel like your life, your very life, is in danger. These are circumstances and all the places that triggers can come from. Now, there are specific characteristics of triggers. And the main one is that triggers, regardless of the source, are rooted in past traumas. Triggers, regardless of where they come from, are usually sudden and spontaneous. And they almost always bring on intense emotional reaction to whatever we're dealing with. So those are basic characteristics of triggers. One thing that you and I need to know is that when we react to trigger points, regardless of whatever the intensity of the emotion is, it is not permanent. Meaning that it comes and it goes dependent on when and how we are triggered or how we are exposed to those trigger points. The question is, why do we get triggered? I believe that that's something you and I, need to know. Now, there is a part of our brain that is, that plays a part in us responding to trigger points. The limbic system, which is the reactive part of our brain, usually takes over the prefrontal cortex, which is the thinking part of our brain. So because the limbic system is the predominant part of our brain that is in motion when we are triggered, we go into flight or fight mode. It's like experiencing something before you even have the ability to think about it. Now, there's a possibility that with practice, you can learn to get to a place where when you are triggered and the intensity of that emotion is manageable, you are still able to kind of talk yourself through it. But like I said, it takes practice. But for the majority of us, when we are triggered in that moment, it's really hard to process at the same time. It's almost like you react first, then you think later. But the key thing here is that our brain plays a part in our emotional response to a trigger point. And I think that's key so that you are able to, practice and find trends and make sure that you reduce the intensity of the responses. Okay, now let's look at types of triggers. When we talk about types of triggers, we are looking at the first part, which is the external part. The external triggers are triggers outside of you. They are in the environment. Mostly you don't have so much control over. And we have the internal triggers. The internal triggers are something that you think about, you ponder over. If you don't tell somebody you're going through or you feel in some way, they will not know. So those are the internal triggers. Now, besides these two, external and internal, trigger points can also be broken down specifically into things like anniversary trigger point. Now, when we talk about anniversary trigger point, we are referring to, feeling in the intense emotions when a specific anniversary or a date is approaching. For instance, the date that you lost a loved one, the date that you experienced significant amount of trauma. There are some traumas you assign dates to, and there are others you don't necessarily because it comes and goes, and maybe you have not really paid attention to. But those are specific anniversary trigger points. And it's important for you to kind of realize that, whatever you experience, it does not necessarily mean that you have to put a date on it. But some things are so significant that even if you don't want to keep a date or keep track of, you still remember those. So those are anniversary trigger points. The second one is trauma trigger point. Like I said, there's some trauma you don't put date on it. However, your body has, kept that score of the trauma. So even though you haven't kept a date or you haven't, logged it or written it down, when it gets closer to that significant time, it's like your body, you're feeling unease about something, and you begin to kind of like draw your attention to that trauma. So those are specific traumas, trigger points, which are rooted in specific events that you don't keep track of. Now, we have holiday trigger points. We are in the last 2 months of the year. And as the holidays approaches, you want to be mindful of any holiday trigger points. Dealing with family, dealing with people. For instance, if you lost a loved one during the holidays, it can be a very challenging time for you. So these are all holiday trigger points that we need to be aware of. As you mingle with family, as you sit at a table with family, you want to take note if there are certain things that are kind of making you unease and you feel like it's going to lead to a significant emotional reaction. Be mindful so that you don't explode. And that's because triggers usually elicits that explosive, intense reaction. You don't want to explode at a family gathering, and you don't want to explode, at a holiday party that's meant to bring happiness. So just pay attention. And the last type is random reaction or random trigger points. Now, when we talk about random trigger point, we are referring to event or seeing pictures spontaneously on the TV, or maybe scrolling down social media, and all of a sudden you come across, an intense picture that you can't take your eyes off. Mostly in social media or like on the news, they give us a trauma trigger warning. It tells you this image you're about to see, or something like that, to prep you so that you don't get immediately triggered. So random trigger points are things that you necessarily don't, you've not experienced before, you've not seen before, or it could be something that you have seen prior, but because you are not prepped for it, as soon as you see a gruesome image, either on social media or on TV, you get triggered. It's important for you as an adult to be mindful of what you watch, and most importantly, to watch out for our children, what they are watching. Because when they get exposed to random trigger points, it will increase the frequency and intensity of their stress relaxing system. And that's not good for that. So let's keep in mind, as we get together with family and friends, we want to understand that there are some instances and some things and smells and people and colors that may, trigger us in a way. But it's also crucial that you don't allow yourself to get to the place and point of exploding and experiencing intense emotional reaction. In a couple of weeks, we're going to talk about some symptoms when you are triggered and how to manage triggers and emotional reactions. Thank you for joining me once again. Like I said, I appreciate all of you. And if you have not subscribed, please do so. Thank you again. Bye.